So basically in children we have our two types of disorders. One is basically cyanotic disorders, congenital heart diseases में, and the other are acyanotic. Now basically before moving and focusing on what's written in my notes, try to focus what I'm trying to recall at this moment. I'm really sorry not for a good setup here, but just revising it at a very last moment, and I'm trying very honestly hard that I'm going to cover all the subjects in just a few minutes. So congenital heart diseases में we have to understand that we have two things, ठीक है. एक होता है cyanotic and the other is your acyanotic, ठीक है. Acyanotic is most common. How we're going to know that? Example, the question I'm asking you, remember, the most common congenital heart disease can occur at which time period? 3 to 8 weeks, ठीक है. Which time period में? Because that is the time when organogenesis occurs. MCQ number 1 covered. MCQ number 2 would be, what is the most common congenital heart disease? That would be my VSD. But अगर VSD आ रहा है तो अगर क्वेश्चन आ रहा है क्वेश्चन नंबर 3, what is the most common cyanotic congenital heart disease? Will my answer be still VSD? No, because VSD is acyanotic. So the most common cyanotic congenital heart disease would be TOF, tetralogy of Fowler, and the most common congenital heart disease, acyanotic or normally congenital heart disease overall would be VSD. That is it. Ab cyanotic means that cyanosis, the bluish discolorations. Before that, moving towards it, I'm going to tell you. Cyanosis is a condition whenever which results from hypoxia, ठीक है. अच्छा, hypoxia is when you have less O2 oxygen concentration in your blood. How will you define oxygen saturation कितनी कम होगी? That will result into hypoxia. That will be less than 94% saturation of oxygen, ठीक है, जो हमारे पास saturation of O2 होती है. But will all hypoxia patients will end up cyanosis getting bluish coloration? No, you will not get it. Why? The reason would be hypoxia will lead to cyanosis conditions. Very true. But cyanosis is a condition when the saturation of oxygen would be less than 84 or I guess 85%, ठीक है. Just checking it out. 84 or 85. It is basically 85, ठीक है. I'm really sorry, ठीक है. साइनोटिक की भी दो कंडीशंस होती हैं, सेंट्रल एंड पेरिफेरल. नॉट गोइंग टू द डिटेल्स, विल लर्न इट वंस वील रीच द साइनोटिक congenital heart disease. Now the most common is basically my acyanotic congenital heart disease. That is my acyanotic. Now what are the acyanotic congenital heart diseases? I'm going to remember that. So there are 4 of the acyanotic heart diseases. Acyanotic means that the person or the bachcha is not going to turn blue at least, ठीक है. Later on they'll turn cyanosed because of the few conditions and the complications I'm going to tell you. Early in life when the problem will occur, before any complications or after many years this problem को अगर आप छोड़ देते हो, then later on they can convert into cyanotic conditions. That is a different perspective entirely. But the patient will not, bachcha will not convert blue. First point. Now how to remember that which people are actually acyanotic and which are not. Acyanotic heart diseases हमारे पास होते हैं दो conditions में. एक वो condition जिसमें हमारे पास pulmonary blood flow बढ़ जाएगा. आधी complications तो इस statement से याद हो जाएगी. This is the heart, ठीक है. This is your right atrium, right ventricle, left atrium and left ventricle. Simple सी बात है. If the blood is moving, for example, from left to right, I have told you before, like after birth, the left side के जो blood pressures होते हैं वो ज़्यादा होते हैं pressures और right side के कम होते हैं. तो of course from high pressure to low pressure जाएगा. अगर मैंने suppose करो कोई भी hole बना दिया यहाँ पे, ठीक है, तो left atrium से right atrium blood will go. What will happen? The pressure, because of the pressure it will go here. Right atrium से blood कहाँ जाएगा? Right ventricle में. Right ventricle से pulmonary में. Pulmonary से lungs में. तो pulmonary blood flow बढ़ गया. At the end of the day pulmonary blood flow से left atrium में आके left ventricle से जाके जा तो normal रहे. There is no mixing of oxygenated and deoxygenated blood here, ठीक है. That means the patient will not get blue. तो the shunt अगर left to right है according to the pressure gradient, that is basically my condition which is resulting into increased pulmonary blood flow. Beautiful point. अगर आधी complications तो इससे समझ में आ जाएंगी. अब what are the connections? अगर मैं देखूं तो मेरे पास right atrium होता है, right ventricle होता है, pulmonary artery होती है. ऐसा ही होता है. Left atrium होता है, left ventricle होता है, aorta होता है. इन तीनों के connections में अगर मैंने एक shortcuts डाल दिए, लेफ्ट एट्रियम से राइट एट्रियम कर दिया, लेफ्ट वेंट्रिकल से राइट वेंट्रिकल कर दिया और एओर्टा को पल्मोनरी आर्टरी से कनेक्ट करवा दिया, तो ये सारे होल्स हैं. Atrial septal defect, ventricular septal defect and patent ductus arteriosus. I've already told you ductus arteriosus is basically एक कनेक्शन होता है शंटिंग सिस्टम बिफोर बर्थ विच इज सपोज टू बी फंक्शनली क्लोज एज 10 to 14 hours आफ्टर बर्थ एंड स्ट्रक्चरली और anatomically closed at 10 to 21 days after birth. And the main indicator for closure of ductus arteriosus during initial after birth is oxygen, the first breath that baby takes. If, for example, that is not happening, that remains persistent, and that results in a communication between aorta and pulmonary artery, because the high pressure in aorta and pulmonary artery में low pressure होगा. ठीक है. The second condition in which can result into acyanotic congenital heart disease is a condition जिसमें हमारे पास aortic narrowing होगी. अगर मैं aorta की narrowing करवा देती हूँ तो blood flow towards the body would be reduced, the cardiac output would be reduced, but there is no particular you say mixing of oxygenation and deoxygenation or oxygenation saturation का कोई problem नहीं आ रहा, but the amount of blood reaching the body parts is less. That actually means that acyanotic होगा, but congenital heart disease तो है because congenitally आपके पास aorta narrowed है. Are we done here? So these are the 4 things you have to remember. You just remember the causes. पर एक ऐसी conditions जो pulmonary blood flow बढ़ा दे. Of course, I have right side here, I have left side here. तीनों के connections बना दिए, तीनों के connections हो गए. Of course, then I have aorta की shortening है, aorta जैसे ही short हो जाएगा, of course मेरी सारी problem solve हो जाएगी. These 4 conditions are acyanotic.